We're Group 28, and this is our Population Health Intervention. I'm Bailey Moynihan.
I'm Sachi Kobayashi.
I'm Sarah Dorian.
I'm Molly Geary.
I'm Benil Abraham.
Our health intervention is based on the mission statement of the American Diabetes Association. This organization works to prevent diabetes, give resources to those living with diabetes, and to fund research for a cure for diabetes. So our health intervention is mostly focused on the preventative aspect of diabetes.
The populations that are most affected by diabetes are the urban population, the African American population, and low-income neighborhoods in the St. Louis area. Contributing to the increased risk of diabetes is that these populations may live out a more sedentary lifestyle. African Americans generally have a higher predisposition to getting diabetes due to their genetics. Also, it is likely that someone, especially children, in a low-income urban environment live a sedentary lifestyle because their neighborhood is a dangerous place and may not give them the opportunity to be active outdoors. Also, these populations may not have the financial stability to afford nutritious foods, leading them to purchase cheaper, non-healthy foods. The local community center would be the best place to hold an educational intervention for a St. Louis neighborhood because it would be an easily accessible location for all community members. The site would be in walking distance from the homes of the people, or transportation would be accessible, enabling these people to come to the education seminars. The local community center would be a familiar place for all to gather, making more people interested in attending the educational meetings.
The population needs more education about diabetes risk factors and prevention. According to American Diabetes Association, 103 children born after 2000 will be affected by diabetes. Stated before, based on these statistics, low-income African American urban neighborhoods are at high risk. So that's why we're going to neighborhoods with these three populations to explain more about diabetes and the preventions that can be taken.
Our logic behind our educational classes follows this diagram, which is based on the health belief model. So in our population, people probably do not think they are susceptible because it is not something that people constantly think about. But if they do understand their susceptibility to diabetes, then people will take preventative actions if they feel they might be susceptible to developing diabetes. Along the same lines of susceptibility, the people of our population don't understand the severity. But if they did, then they would take preventative actions if they are aware of the severity of the disease and the potential of developing diabetes. Once they understand their susceptibility and severity of diabetes, then they will realize the benefits of promoting their health to prevent the disease. Along with these preventative health benefits, there are also barriers that they must accept, but with the education, they will be willing to overcome the barriers in order to prevent diabetes. The education that our service will provide will work to reinforce the health, nutrition, and physical activity message in order to prevent diabetes. Finally, once the population understands all of these steps, they will have control over their diet and exercise. Then they will be more likely to make a positive change in their life and will lower their risk for diabetes. The first step has to be education classes that we will provide, because in order for them to make a lifestyle change, they need to know the risks of their current lifestyle.
Our short-term goal is to get out enough information about how to prevent and treat diabetes. Our long-term goal is to decrease the amount of individuals being diagnosed with diabetes in our population.
Our mission statement is to prevent and cure diabetes and to improve the lives of those affected by diabetes by providing quality treatment and education not only to the populations affected but also to the healthcare providers.
We chose the health belief model in order to organize our intervention because it is the most related to the population's situation with diabetes. Many people are unaware of the risk factors associated with diabetes. These include being of African American descent, living a sedentary lifestyle, such as in an urban area, and unhealthy eating habits. Many of these criteria are preventable. The population just needs to be informed on how people get diabetes and what they need to do to prevent it. That is why the health belief model will shape our program to provide education to our population about what diabetes is, how people get it, and how to prevent it through an active lifestyle and healthy eating habits in order to lower the population's rate of diabetes in our community.
Our intervention is to have educational diabetes prevention classes that will be held at a local community center in an area with a general high risk for diabetes. The classes will be taught by volunteer health professionals in order to be cost effective. The classes will inform the community about what diabetes is, how you can get it, how it is treatable, but also very costly and detrimental to one's health. The classes will mostly focus on what preventative health measures can be taken to prevent the onset of diabetes too, such as healthy eating habits, the importance of making healthy lifestyle choices, exercise, and recognizing the at-risk groups such as African Americans, Latinos, hereditary factors. The classes will be taught during a weekday evening. This way the adults of the community can come after work. It will also be in a kid-friendly environment, so there is no worry for finding childcare. In order to evaluate the program, a closing survey would be given to participants to evaluate on a scale of 1 to 5 of how much new information about diabetes was learned and if they will apply this to their life. In addition, they will be asked what improvements can be made to the class or if they would recommend the class to a friend. Gradually, over time, the numbers of how many people in the area are diagnosed with diabetes type 2 will be looked at to see if the preventative care is making a difference in the community.